are some early signs or early indicators / red flags that you might notice with your loved one that could be indicative of a different care environment. You might notice that your loved one is having difficulty managing their medications, which we've talked about a lot. But some things you might see is that they aren't taking their medications at all, or they're taking too many and their prescription is running out too soon. They also may have them all jumbled up and shoveled in a drawer and really not know what they're supposed to be taking. So that's an early indicator. The other things that you might notice are difficulty with cooking tasks. Using a microwave becomes more difficult, not knowing how to use the controls on that microwave, or sometimes leaving the stove on too long and burning food items, or not understanding how to turn on the digital temperature of the oven. The other thing you might notice is weight loss or weight gain, and that's simply because that loved one may be forgetting to eat that meal or not remembering that they had breakfast, and they have difficulty even organizing and planning a nutritious meal. So somebody who may have been a great cook previously now just grabs, a peanut butter sandwich for every meal because that's the only thing that they can think how to process and make. The last thing that's really important is the ability to communicate in an emergency. And so can your loved one dial 911 if they need to? Can they call you if they're having issues? Do they understand how to use the phone or even a life alert button? And if not, this is the time when you really need to start having difficult conversations with your loved one about what are their next steps in life and what are some care options that might be available to assist them.
Safety is so important. And I think that's sort of that one thing that kind of is the differentiator between where you are and the next step. What type of options, Lynn, are out there for senior care for someone with dementia?
Sure. So just remember that everybody's journey through dementia is unique. So I can give you some typical care environments for certain stages, but it may be different for each individual. So in early stages, or what we might call the mild stage of dementia, home health services and personal services agencies might be beneficial. And also you could start exploring an independent living environment or assisted living environments. In the mild to moderate stages, there are assisted living memory care units that cater to residents that have dementia, that have specific program that can help them maintain that stage of dementia for a longer period of time. And then for the moderate to severe level of dementia, you might start exploring memory care units in skilled nursing facilities. And those are for the residents that have kind of transitioned and need a lot more help with their self-care and a lot more 24-hour guidance to be independent in an environment. And then there's the severe stage of dementia. And at that point, you're really looking at a skilled nursing facility that can provide that 24-hour care of nursing and physical assistance that the residents may need. But also you might start exploring hospice services as well.
One of the hard things is any ideas and tips on how to even broach the conversation with someone if they are needing a different level of care and maybe it's not working at home? How do you start that conversation, or even bringing services in to the home?
I think what's important is not to prolong the conversation. As soon as you start noticing these signs or red flags, you want to start having those hard, difficult conversations. And it's going to be tough. Nobody wants to admit that they need help. And it's very difficult to accept that your memory or cognition might be declining. So if you can approach those conversations from a place of love and support and include your loved one in decisions, let them look at literature about the different types of support services that are available. Let them tour facilities and help them to have that choice or that opportunity to be involved in the decision of what services they'll employ or what environment they'll be admitted to. And then lastly, always explain to them that really we're looking at how can we support you so that you can remain as independent as possible, as long as possible, in your current environment. And then when you have to move to the next environment, the goal is to keep you at that stage of dementia for as long as we possibly can and to prevent any declines.